Next, we have James Marciano with Lighthouse.
Good morning, everyone. All right, let's see if we can get this to work. There we go. Cool. So my name is Jimmy Marciano. You can call me Jim. So we were actually founded in Sugar Hill, Georgia, about 14 years ago. And out of curiosity, how many of you all have ever heard of a patient communication system? By show of hands. Okay. Now, how many people have actually used a patient communication system? Almost the same amount. Okay. So in this day and age, things have changed. So instead of calling everybody, there's many different ways to confirm patients. We're all here for the patients. So if we can use a text or an email in their preferred mode of communication, that's exactly what I'm here to talk about. So the first thing that I wanted to show you here are a few KPIs that we've actually pulled together from last year. We do a survey every single year, and currently with over 14,000 clients under the Lighthouse umbrella, all dental offices, because we are a dental-specific company, this is what we've actually seen. So less no-shows in the office means increased production, which leads to less time spent on the phone, which I'm sure everybody in the front office can attest is a good thing, right? So if we can do 1, 2, or 3 of these things, it's an absolute no-brainer. Something that really differentiates us is our process for confirming appointments. So here you're going to see a few timelines that we've put together here, on top, and the benefit to Lighthouse is we are a fully opt-out program. A lot of other softwares out there are opt-in, which means it leaves room for the patient to flag that as maybe a marketing text or a marketing email or a marketing phone call, and that can be an issue. With us, they can unsubscribe from any form of communication that they're not satisfied with, making sure that we're tailoring this not only to the office, but to each patient coming in. Beneath the confirmation timeline, you're going to look at unscheduled patients. So I'm sure this is something for not only general practices, perio, ortho, and the such, that is very painful to make sure that we are bringing these patients back. People are not only forgetful, however, people don't respond all the time to a phone call. And I can tell you with complete confidence, being a business person that's on the road 75% of the year, my voicemail still gets full, and that's my job. Let alone if you're a patient, sometimes you don't check your voicemail, and a lot of times they're not even returning that call to the office. So what we end up doing here for you is structuring a timeline based on your patient's preferences. Now, since we are directly integrated with the management software that you're using, it turns off as soon as we pick up that patient has scheduled an appointment. Now, on top of that, we want to let your office know what we're doing. So where it says after due date, we send you an email every single morning giving you a list of the patients that have not responded previously. So now it's our recommendation to give them a call. The info's right there, so you don't have to dig through your management software. And the benefit for you is not only does this hold the patient accountable, but it holds your staff accountable, giving you a very, very seamless process in place. And then beneath that, we take care of your treatment as well. So I'm sure there's a lot of instances where somebody comes in, maybe a crown prep, they got to check with their wife, they don't schedule right away, and they may slip through the cracks. So what we end up doing here for you is giving you a consistent process to follow up. And once again, since we're integrated, as soon as they schedule for that visit, we take them off the list, okay? So the next thing that really does stick out is what we call true time data. We have the ability to update every 10 minutes with your management software, and that's just due to a Delta sync that we do versus a drill or a data sync, which can drastically slow down your server. Ours is not going to do that. The next piece of information that I wanted to touch on here is what we do from an efficiency standpoint. So on the right-hand side are going to be what we call currently tracked items. There's about 25 of them there. Each office is a little bit different, so you would tell us what is important to track for. For example, we can not only look at the email field if it's full, but if it's actually being opened. We track read receipts. We also can track mobile numbers. Now, this not only means the mobile field inside of, let's say, Dentrix, but this is a binary coding that the mobile number has that our software can actually pick up. We can also do family members past due, which is pretty crucial, especially if you're seeing a husband and a wife or children of the same family. And if they recently missed their recall, we're going to let you know before mom leaves the office. Do us a favor, get them both scheduled. So this is easily printable, sitting in your front office every single morning. So by a show of hands, how many people actually do morning huddles? Weekly huddles? Monthly huddles? We can actually have this out in front of you so that you can go through that as a guideline of what you need to get done for the day. Now, this is just an example of how some of our messages look. Email on the left, text on the right. Obviously, this is a family reminder. However, an individual reminder would look very, very similar. We do brand your office, but something that does separate us is our ability to respond or understand multiple responses as a confirmation. So a lot of other softwares can only detect the letter C or yes as a confirmation. They're case sensitive, which can drive your office insane if you're having to still call when you have a system in place. We can understand, yes, I'll be there, see you soon. We actually read the message. And on top of that, we actually give you about 162 characters to work with versus the 76 or so that most other softwares give you. Okay? Now, I briefly wanted to touch on special messages here. On the bottom of both of these messages, you're going to see specific pre-op instructions. So Lighthouse has the ability to read not only the ADA codes, but all of the treatment procedures within your management software. We can look at medical fields. We can look at flags. We were actually developed by an office manager who is an IT professional in Sugar Hill, Georgia. So a lot of those little nuances that are going on in the office, Lighthouse understands. We can link with any software that you have. So let's say you use a website, which by a show of hands, I'm sure everybody's hand would go up here. What we can do is link new patient paperwork, making it very, very easy for them to fill out. All integrated, and we give them a directional app to the office as well. Now, in terms of communication, we want to make this very, very easy for you all to fill any empty gaps in the calendar. So I'm sure you can all think of a time where somebody breaks an appointment on the same day and you need to fill those holes in the calendar. Lighthouse is here. So we can access the ASAP or sooner if possible list in your management software so that you can blast out a quick text message, making it easy for them to respond. This is all done directly in the office. And in terms of reviews, something that does separate us is giving you the ability to integrate with third-party outlets. So as someone leaves your office, let's send them a response. And we're going to vet this feedback by asking them a simple question. Were you satisfied? Yes or no? If they say no, the response goes to you. If they say yes, we can direct them to the sites of your choice. So we have made a few positive updates since the previous year. Just like we want to follow up with patients, we also want to give the ability to actually drive in new traffic. And I understand with so many marketing companies out there, it's hard to track from all these multiple dashboards. So this is something that we've rolled out due to our parent company, web.com. These are Lighthouse ads. We give you a simple way to track all of these leads coming through and ad spend budget that you give us. And we also have call recording. We have a very sophisticated way for you to mark where these clients are coming from so that you know where every allocated dollar is being spent. So, in total, we're month to month. No contract. This is not based on a per provider. This is based on a per practice. And for the second time, we are waiving a setup fee. So that is the special here at the conference. Please stop by booth 626. Come chat with me or Whitney, my colleague, and we'll be more than happy to help out. Web.com's across the way from us as well, and they are giving away PGA tickets for anybody that signs up. So thank you so much.